You also shared your questions regarding assistive technology. And one of the questions that came more often was you guys asking each other what kinds of experiences you had had, especially at Success Academy using assistive technologies. And many of you shared different kinds of things you had done. You were curious about how to use iPads as assistive technologies. You were interested in knowing the drawbacks of incorporating assistive technologies in the classroom, and some of the things that came up were when students feel singled out because they're using a specific technology, and how that even interfered with their learning because they did not want to use the one technology that was best to help them in particular. You were also very concerned about training, and you recognized that you hadn't received much training in the use of assistive technologies, and you thought that was a very important issue to consider when bringing different kinds of technologies into the classroom. You were concerned about students getting dependent on the different technologies, and of course this issue, it depends on the student. If the student has a disability that it cannot be corrected ever, well, there's definitely no way around it. The student will always depend on that technology. But if the technology was actually help them get trained so that they could develop the skill, because maybe they do develop the skill just as at a slower rate, then yes, the concern about the student getting dependent on the technology was a valid one. But certainly we have to think of this in terms of whether the student is actually going to need the technology for the rest of life or whether it's really just a temporary thing. And so you also talked about issues in terms of using assistive technologies like class management and those kinds of things. A couple of our classmates shared some resources that can be useful for assistive technologies. This one in particular is from the New York City Department of Education. We also saw documents regarding assistive technologies. This one from the Colorado Guidelines for Health Professionals, Educators, and Administrators. This one was from South Carolina. And so, in general, I want to congratulate you all for the work you've done this week. I was very pleased with the level of the discussions. You are incorporating the readings and the texts for the session in your conversations, just with very few exceptions. And I want to encourage those who forgot maybe to bring in the readings to actually do that from now on so that you don't lose points in the discussion. But you did a very good job in bringing in those texts and also citing them properly and all that. So congratulations. I'm looking forward to our conversations this week.